Welcome back to Great Day St. Louis. Wearing a face mask has become the norm in order to stop the spread of COVID-19, but there are so many questions that surround them. When should we be wearing them? Are they really keeping us safe? So we invited an expert on the show to provide us with some answers. Please welcome Dr. Steve Lawrence. He is an infectious disease specialist at Barnes Jewish Hospital. Thank you for joining us today, Doctor. We're so happy to have you. The first question that we are going to start off with is, when should we be wearing these face masks?
Yeah, I think it's important to remember that anytime you step outside of your house, think about a face mask, and you're going to need it whenever you're in an indoor setting outside of your own home. And in almost all cases, unless you happen to be completely by yourself, or say you're going to work and you have an office that is just enclosed and you're by yourself. But for all other instances, when you're outside of the home and an indoor setting, you need it. You also would need it if you're going to be in an outdoor setting where you can't ensure that you're going to maintain at least 6 feet of distance from everybody. So if, say, you're walking in your neighborhood and you can avoid being close to people, then that's fine. But if you're heading outside to a park where there's a lot of people or some sort of public event, you need a mask then too.
So we have to ask, are there any exceptions to this rule?
Well, the exceptions are around a couple of different principles. One of them is if, again, you're indoors totally by yourself, if you're outdoors and can always maintain more than 6 feet of distance from everybody. But the other principles of not wearing a mask would be if there's a medical reason for it. People who have trouble breathing, even without a mask can make it worse. So there are health reasons why somebody might not. Young children, certainly below the age of 2, should not be wearing a mask. It could be dangerous to them as well. There are other instances too where people who perhaps are hearing impaired and need to be able to read lips, that the person that they're communicating with may not be able to wear a mask during that time. And of course, when you're in a swimming pool, a mask could also be dangerous as well.
So how safe is it for all of us to be breathing in our own breath for long periods of time?
Well, the good news is these masks are built to be able to breathe in. So there is enough of the carbon dioxide that we exhale does go through the mask, and enough oxygen comes in that it is not a health risk for most people. Again, if you do have some underlying lung problems, heart problems, there might be some people who could have some trouble with not getting enough oxygen in. But for the vast majority of people, there's no risk of breathing in that little bit of your own air.
Dr. Lawrence, we appreciate it. Thank you so much for joining us and walking us through all this.
All right, thanks, and be safe.